I start, sir.
Yes, please start.
Okay. The Dr. Manu V.L. Kothari Chair and Division of Medical Humanities and the Gosumec Alumni Association, under the patronage of Dr. Sangeeta Rawat, Dean, State GSMC and KM Hospital, welcome you to this session of Revenue Services. I request the tech team to play the video about medical humanities. State GS Medical College and KM Hospital to be celebrating its centenary soon. As we prepare for the centenary celebration, we have a message from our Dean, Dr. Sangeeta Rawat ma'am, in the form of a PowerPoint presentation. I request the tech team to please play the PPT. It is the students, past and present, that make our college what it is. So, as our 12 institutes move towards their centenary, we wanted to give a virtual platform to every batch of GSMC to share their fondest memories of college. Their thoughts and emotions will be preserved forever in the form of these reminiscences. This is the GA membership form. To remain connected to our alma mater and informed about the activities in KM, including the centenary celebration, we request you to become members of the Gosumec Alumni Association, the official alumni body at State GSMC. All the details on how to become a member and this membership form are available on KM website. All those who are not members as yet are requested to please visit the KM website. Uh, may I request the batch coordinator to cover the proceedings?
Dr. Amrita has just joined, so she can take over.
Hello, everybody.
Yeah, audible, Dr. Amrita, not seen.
Video is not on.
No issue. Okay,
Oh,
go ahead.
okay, sir. So, welcome everybody to this online meeting. I can see quite a few of us have joined. Hello, everybody. Actually, first of all, I would like to thank Dr. Natarajan to have enabled us to meet virtually. And many batches are meeting on the occasion of 100 years of celebration of St. GS Medical College. So, can we start the video recordings?
Hello.
I can't
You can
hear.
start. No, you can start. I had muted. Okay. Yeah,
Oh.
you can start, please. Yeah. Okay.
So,
Yeah, please.
I'll have to excuse myself for 2 minutes. I have another issue. So,
So just ask one of your batchmates to take a blame. Chandresh name I didn't see.
Yeah,
Okay,
Sir
but
Chandresh is not seen right now. Dr.
Okay.
Uday Kulkarni and Dr. Gauri are there. Hi,
so
Gauri Uday.
let them start the proceedings till you take over.
Yes.
Okay.
Please take over right now. I'll just be back in 2 minutes. Yes.
Hi everyone. Uday here. Hello, sir. I can see quite a few colleagues. I think can we start off with what is the general format? Can we have just the introductions of all of us?
Hello. See, there is no hard and fast format, but basically your batch is going to recall your 6 years down at KM at the occasion of centenary. Okay, there were some set questions which I had sent to Amrita, so possibly she'll take over when she joins back. Till that time, you can formally just try fond memories of your time. Yeah, please feel free.
Yes, I can see. Yeah, I think I and Gauri are here. Currently, we are working at Vellore, Christian Medical College, Vellore. Both of us are faculty members. Can we introduce, where we are currently working one by one? I think that would be a good thing to know where we are currently. Sandeep, I can see Sandeep, Bika.
Hi, Gauri, and hi, Uday. Hi, everyone. Hello, sir. And I'm working as a pediatric and neonatal intensivist at Raipur, and I have my own setup, 25 bedded pediatric hospital. So I'm looking after that. It's nice to join here and to see old friends once again. I think recently we met everyone in the recent get together. Yeah, but once again, meeting here is again, it's always old memories are cherished.
Good to see you, Sandeep.
Yeah.
Preetham is here.
Hi, everyone. Hi, sir. Hello, sir. Yeah. So, myself, I'm a medical oncologist. I'm at HN Reliance Foundation, Mumbai. I'm working here for last 6 years as a consultant here in medical oncology. Yeah.
Nice. I think Bika is here, right?
Yeah. Bika is there, Sanjeev is there, Priyanka is there.
Preetham's birthday was recently.
Belated happy birthday.
Happy birthday.
Thank you.
We had a list of people
Pritam
wishing
didn't
him.
respond on the WhatsApp group.
मुझे इस पे join
Sorry,
करके दिला
sorry.
देंगे।
I got late yesterday. I'm really sorry for that.
Hi, Bika is there. Hi.
Hello, am I
Hi.
audible?
Yes, Amrita.
Okay,
Yes.
so good. Thanks for taking over for this
Yeah,
brief
I think
time.
Amrita is back, so I think better.
Yeah, actually, the camera is not working. I had to change my laptop the last minute. There was some issue.
Okay.
Okay, so should we start with there are a few questions that sir shared with me, which I can ask each one of you and you all can, tell and we can proceed ahead in that way. So I think Priyanka has not said anything. Hi, Priyanka.
Hi.
So I'll ask you the first question on the list. So that's
Okay.
why did you choose the profession of medicine?
Why did I choose? So science has always attracted me when I was doing my school. And so the real reason behind that, like that trigger was like my brother and sister, they both are deaf. So I really felt that why, like I wanted to know why they're born like this. So I wanted to, be in that profession just to understand. And maybe at that young age, when I was in class fifth or sixth, I had a thought that maybe I can do something for them if I become a doctor. So that was a very school girl kind of a thought. So that is how I entered, and then subsequently I developed liking for biology, and that's how I entered this profession.
Nice. I'd like to narrate my own incidents of choosing to be a doctor. So I had a squint at a very young age, and I was operated at age of 7. And then I wanted to understand why I developed this, and that's what motivated me to be a doctor. So okay. So now, hi Sanjeev. Even you haven't spoken yet. Hello. Cannot hear you, Sanjeev. Can you unmute yourself?
Yeah. Hello,
Yes.
good evening, everyone. Actually, my reason of joining medical is my parents, and they want me to be a doctor. Later on, I developed interest. Uh, so, nothing more than that. I want to say regarding why I joined medical.
And I would like to ask you why you chose SAIT GS Medical College.
Sir, GS Medical College, yeah, that's a good institute. And I heard just before our counseling about Sergius Medical College. Very few medical colleges are there which has been left at that time, and JJ and Sergius. So someone has suggested that Sergius is better than JJ. That's why we went for JJ. Sorry, Sergius Medical College.
I can see Bhika there. Hello. Good evening, Bhika. So another question I'd like to ask you is the next one. I'm just going ahead with the list with what I have. So the next one for you is what was your first impression of SAIT GS Medical College and KM Hospital? You are not audible, Bhika.
Am I audible?
Yes. Thank you.
Yeah, before coming to that, मैं ये जो हमारे बैचमेट है, हमारे बैच के कुछ मतलब in their 40s they left this world. उनके लिए त्यांना मी भावपूर्ण श्रद्धांजली आपले काही मित्र आपल्याला सोडून गेले त्यांना मी attribute करतो. Yes, coming to your question. Yes, I was in my 12th standard. I was preparing for IIT JEE, but unfortunately, I didn't qualify for that, and the option I left was this only. And few of my seniors from my town was there in GSMC, so I choose GSMC, and it was my best choice in my life. So, and after completing my MBBS, I did my MOship, and after that. I started my coaching institute for IIT preparation. So we worked in that coaching institute for almost from 2011 to 2020 till COVID started. So the COVID it was a sudden halt for our business. It was running good, and because in COVID, everything was shuttered. School, colleges, and everything. After that, I was looking for another opportunity, and I entered in healthcare sector, and we started with 100-bed COVID setup in Pune. Uh, so we worked very hard for 2.5 years at our hospital for 2.5 years, and I'm continuing same hospital with 35-bed multi-specialty setup. And we are offering multiple uh, uh, services, medicine, surgery, and Pune is nearby to me, so I am getting good surgeons and physicians to cater a good healthcare at affordable price in rural areas like in nearby Alefata, Manchar, Naranggaon. So nice to see you, and thank you for Dr. Natarajan sir. He is very hardworking, and I'm yes sir. Thank you sir. It's my great pleasure to have in this meeting, and I will be always grateful to your knowledge and your passion for anatomy and in general medicine fraternity. Thank you, sir. Thank you. Over to you.
Thank you, Bika. So Sandeep, can I ask you a question?
Yes.
Yes. So Sandeep, do you have any memories of the admission process?
Yeah, admission process, it was memorable because it was raining heavily that day. And I accidentally met Sumit.
Huh.
He was, in first instance only, he looked to be very sincere kind of guy.
I
So,
guess all of them.
so I was like, कि, मतलब, we became friends that time. And the first instance where after admission process was somewhere else, centralized admission, I think. And then we came to KM, and it was in like first time in my life I entered that institute. So like uske baad mein फिर immediately after admission some of us got that Naigaon hostel, and we went there. Deepak is also here. Deepak, me, and a few of us were, Pritam was in Mint, isn't it? मिंट में
Yeah.
था क्या?
Yeah.
तो फिर वहीं से लाइक एडमिशन प्रोसेस के समय वन मोर पर्सन विच वी रिमेम्बर इज आर जोशी भाई. आई थिंक मोस्ट ऑफ अस माइट बी रिमेम्बरिंग.
Yes.
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 So all these fond memories are there with us.
Amrita, I would like to speak something about this because
Yes,
I had
yes,
like really
certainly.
faced a hard time, and at one point I even thought that should strive to get admission here or not, because it was such a difficult process being from outside Maharashtra, completing so many documentation process. So I remember Joshi madam telling me, like, my father is a very organized person. He has got 10 files made, 10 copies, and all mark sheets, everything. Like, he used to be a very pitch perfect person, so I thought my admission will be done very quickly since I got it from all India. So there was some problem with the all India counseling at that time, and so we came to Mumbai once for admission. We were like just thrown out, no admissions, you can't take admission here. Then come later. So when I asked when, so she said no date, you just inquire and when to come. Then we came for the second time. The second time, she said, okay, admission process will start. So like it took me 3 days to complete admission, and my father kept running from one place to another. No, get this form signed from X place, then get this form signed from some Y place. And my father and we all got like so tired. So at one point we were like thinking, is it real that really I'm going to get admission here or not? And like Sandeep shared that we made a few friends. So yes, there was a few other people who have joined from all India, like Umesh, Sumit, and we were all together at that time, sailing through the same boat, and had a really tough time at the time.
Hmm. Well, this is also a memorable instance, actually, the admission process. Would anybody else like to add to that? Okay, so moving ahead, I'd like to ask Uday. So, Uday, what was the physical layout of the campus during your time, and what changes occurred, like some in buildings or structures?
So during our time, I think the new PG hostel was not there. The big 17-story building which is created, that's come up later.
Okay,
So that
the
was not
main
there.
new building, yes.
Yeah. No, I don't think any other infrastructure changes.
Yeah, there were not quite any major infrastructure changes. So, and like, okay, then what faculty members taught in your departments in your time there, and what changes occurred during your time?
Yeah, I think the first year was excellently organized, and I think anatomy, physiology, and biochemistry, all three departments had done a great job in ensuring that people were, get, there people from students from all over the country come there, and I think to streamline that process, I think the all three departments had made a very nice effort. We had a great time. I think anatomy was really enjoyable, excellent teaching experience, which the of all the faculty members, and it was an enjoyable year. I think the second year got a bit more, chaotic, to some extent. I think first year was very well organized. The second year was a bit more chaotic, I suppose.
With multiple places.
Yeah.
Actually, not really.
Regarding this, I just want to add that recently I had a BCME training. Nowadays, since I'm in a medical college, so we have to get the set of training. So in that training, they were teaching us like how the medical education is organized now. And when I was listening to that, I realized like 20 years back, we had the same set of organization by Department of Anatomy. Like it was world class. I was
Yes,
totally.
absolutely.
I was telling everyone that we already had this kind of arrangement. So it was like beautiful, absolutely world class.
Yeah, we both attended that same meeting, so we both had that same experience. Exactly what they're telling, we were doing already. 20 years ago, being taught like that. So
Gauri, so
Can I
moving
make
on.
a point?
Yes, yes,
Yeah.
Pritam, certainly.
Yeah. So I think anatomy was, the discipline making. If you are late, you will be marked late. If you're late for 2 or 3 times, then you are marked absent. So it imbibed a discipline in us that we have to attend our lectures, and obviously
और
all the
proxy भी नहीं
teachers
मार सकते थे.
yeah, and we are blessed that to have great teachers like Dr. Natarajan sir and all of them, that we are very obliged that we have this kind of teachers we had to teach us.
And even the roll numbers were excellently made. I think it was not right like any, or I mean, we were allowed to
Choose the partners.
Choose partners.
Yeah, choose our partners in the first year.
That
Yes.
is such an excellent thought that the new students may not feel comfortable with everyone. They can choose the partner. Even if the partners are also new for us, but still, at least a chance was given.
There was a choice, yes.
Mm.
And what were your experiences, Gauri, in the dissection hall and the laboratories?
yeah, the section hall was really, I mean, I really do remember a lot of those times because before joining medicine, I have had this experience of fainting multiple times, including a place where it was a little more crowded, local trains in Mumbai. So everybody expected me from my family that, okay, the first day she's going to fall down, but it was so well kept. And I remember the strong smell of eucalyptus oil also, which was so well thought of. And that is why it was still a good experience. And I didn't faint. So throughout anatomy, maybe later years, yes, but yes. So they had really taken good care. Our faculty members really took really good care, and we had a nice time there, in spite of it being a place where you've like you're actually dissecting dead people, but with the support of your friends, few people who you know here and there, and the dissection table, you make more friends. It was a good experience.
Nice, nice, nice. Pritam, I'd like to ask you the next question. So, what
Yeah.
was your experience in the library?
Yeah. So I think it was the best place to have. First year, I think when we entered, the seniors used to say, don't sit in the library. Either you'll be ragged.
Yes.
So first 6 months we couldn't enter the library. But the next 6 months we could enter the library, and there were changes made in the library also on the second floor, if you remember. There were two outside sections where there was a lot of people used to come down, sit and chat, and I think, but the reading room, we have the best memories of the reading room. There was a competition to get a place in the reading room and the room adjacent to it. And I think the innermost room had all the stalwarts sitting, the biggies of the hospital.
Yes.
Used to come down and sit there, and it's like you always had that passion to be like them. So that was the other learning point in KM. Yeah.
I have a personal experience. Like the first year, I went to sit in that top first floor library room, and there was this couple sitting there, and I went and sat on their table. Then later, I came to know it is Miss Dr.M.V.L. Kothari, and today I am really proud. I've shared my library experience with him. He's doing very well politically. So,
That's right.
yes. And now who would I? Hello, Gunwant. Um, so how are you? Cannot hear you actually.
अरे अनम्यूट कर पहले.
Hello. Okay, so I'll just ask the next question. Anybody can take it up. Um, what were your notable experiences going to the wards and your encounters with the patients or the relatives that have stayed with you over the years? I think Priyanka, maybe you can answer that.
So I still would say that the experience of having of ward posting in KM is just amazing. I've been to multiple places, like studied at various places after that, and I've not seen that passion of being in wards. The students, like, they're passionate about going to the wards, having bedside clinics. Nowhere else I've seen that passion. Attending hoof clinics, etc. So the wards. So initially for me it was a bit difficult because sometimes the language barrier used to come, but then the residents, the colleagues, and the other JRs and all, they were very supportive, and we got to see like so many variety of patients. We got so much clinical exposure, and I especially remember pediatric posting, and that is why probably I chose pediatrics. Like, I really admired Bavdekar sir, because I was posted in his unit, and after that posting I decided I will take up pediatrics. So like, the teaching was so properly planned for each posting, that bunking posting was not an option for us, like those who are very much interested in the clinical postings. So it was a very good experience, although the wards were crowded, and a lot of us, our colleagues, have contracted tuberculosis also. At the time, we were not very well nourished, but yes, the kind of clinical exposure we get in KM is just amazing.
Any of this experience that has made a positive impact on your personality or your way of thinking, and like something that will be with you throughout life? Anything like that you can narrate?
I think everything, right? I remember once, like, as I said, I got so much attracted to pediatrics because of that beautifully, planned posting. That I remember the teachers teaching us bedside, each and everything. I remember one day Bavdekar sir took a class for 3 hours. He was teaching neurology. And he was demonstrating each and every muscle, like how each and every muscle moves, like how do you do flexion for the thigh, and how do you do extension, everything, like everything from. And I was thinking that I'm getting tired, but he's not getting tired for 3 hours, each and every muscle movement. And yes, I remember that has impacted my life 100%, because I am still, I believe in clinical examination. I do clinically examine all my patients, even if the trend is changing towards doing more investigations and less clinical examination. But yes, that has impacted my life, and that has really helped me
Oh,
as
nice.
a teacher also, even as a teacher also. So I do emphasize to my students that you have to be very sound clinically.
Anybody else would like to add for their experiences? Anything that has made a profound impact on your own personal life, like in professionally, like something which has stayed with you for all these years?
I think Dr. Karnad's clinics are also excellent. I remember, I think that really
Agree.
got the passion towards medicine in many of our batchmates who took up medicine, was thanks to his inspiration. I think that those were also very meticulous, and I mean very precise clinical evaluation, which he used to conduct on rounds used to go on till evening. I remember, it used to start in the morning and go on throughout the day. Uh, I think that really impacted me, at least, in taking up medicine.
Um, Thank you. Vaibhav, you are wanting to say something?
Yes, I would like to add, am I audible?
Yes, yes.
I would like to add my experience regarding Gymkhana basically. So our first year, I think everybody must be remembering that it started late and we were burdened with a lot of studies in first year and we have not got no time during that time. So when we reached second year, that time is like we used to spend a lot of time in Gymkhana. So we used to, I think Sandeep was there at that time with me and Nilesh. There were many of us that time there, where we used to meet seniors and we receive guidance from them as well as we share some good memories over there. So that was a really great time, and that adds that I mean, it's like you need to have misplay sometime also along with studies also. So that is a thing I wanted to share.
Nice, nice memories.
Yeah. And
Anybody?
regarding Khana, that one more thing I want to share. I think it was third year when the sixth book of that Harry Potter series was released. And that was the only copy was available in Gymkhana, which we used to share in hostel. So that memory was there, still there. It's like that was a good thing. I recollect.
Nice. Anybody else would like to add to the like memory which has stayed so far, like made an impact till now?
I would
I
like
really
to.
appreciate the hiking club which was there. The hike club was amazing. I still remember the hikes which we had during our MBBS, and I still yearn for such hikes, but I never got a platform to do the same. But
We will do, Priyanka. Sandeep, you were saying something?
यस, एक और चीज जो याद आती है हमेशा वो है कि जो जब वाइवा होता था हम लोगों का, तो नटराजन सर जो हम लोग आंसर देते थे तो लिखवा लेते थे कि आप लिख के दो कि ये सही, आप बोल रहे हो ये सही है, आप बोल रहे हो ये सही है, लिख के दो। तो ये भी एक मेमोरेबल है, याद में रह गया है।
Yes. Pritam, you would like to say something?
So I still remember the last board exam in surgery. I think it was by Dr. Gandhi sir from surgery, and like we all will fail. Only Swati Gangne passed the exam. We all will fail,
That
and it was
was
like
a
a
fear.
ragging. It was like a ragging.
Yes. Hi, Priyanka, Somanshi. Hello. Yeah, please unmute yourself. Yeah, I think Priyanka and Gunwant, I can't hear. Okay.
Hello. Are you hearing now?
Yes, 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 Gunwant. Do you want to add to some experiences of GS?
Yes. Yes. We have very good and nice memories of our anatomy classes. Dr. Natarajan sir and Manu sir. Dr. Natarajan sir's derivation of words was very amazing. It stayed with us till now. We also, I also remember their derivation of words, and that is why anatomy classes were very memorable in all the curriculum. Very nice.
And what
Because
memories of fellow students, seniors, juniors, whether they were friendly, helpful?
yes, our batch was very friendly, and at that time there was no YouTube or social media. That was
But
very
we
less.
had notes.
We had notes and our gatherings, and our personal communication was more at that time.
Yes,
Nowadays,
yes.
only social media is more.
Yes, one-to-one communication is not much. Yes, Vaibhav?
That time is like I am also an associate professor in a medical college. So today we have this mentorship program, mentor-mentee program. But then we at that time we also had this mentorship program of our second year student used to guide our. There was a mentor from second year for a dedicated mentor from second year was which was appointed for us. So Dr. Tanmay was my mentor, and he helped me throughout my MBBS. So things which are implemented now we used to have that time, like the Priyanka was sharing that BCME experience. So which was great, sir. Means like we used to love means like that seniors has provided really a great guidance, and that program which was implemented in our institute at that time, which was taken by NMC now again, which makes us proud of our institute. So really great.
Yes, great, great. Hello,
Yes,
Arjun. Yes,
Uh,
who's
Hi.
speaking?
yes.
Hi,
Uh,
Priyanka here. Can you hear me?
Yes, Priyanka, we can hear you,
Yeah,
but we
yeah,
can't
it's
see you
nice to
anymore.
see you. You
Can't
can't
see you.
see.
Yeah, it's fine. It's fine. Please talk. Yeah, now we can see you as well. Priyanka, please unmute yourself. It's okay if we don't see
Yes.
you. Yes. Hello, Priyanka. I think.
I would like to share one experience.
Yes, speak up.
Dr. Ghanshyam Vaidya, in our postings, we used to listen the cassettes of that Dr. Ghanshyam
Yes.
Vaidya, the clinical posting. ते ऍक्च्युली 2 महिन्यापूर्वी 2 की 3 महिन्यापूर्वी ही जस्ट पास्ट अवे. त्यांना भावपूर्ण श्रद्धांजली. खूप म्हणजे बेस्ट, द बेस्ट ट्युटर. एव्हरीथिंग वॉज फाईनली ट्यून्ड. The murmur, mid diastolic murmur, and signs and symptoms. Every cases was fully organized by Dr. Ghanshyam Vaidya. His knowledge will be shared throughout the medical fraternity, and the knowledge will be there for your. One more faculty member, Mr. Sham Kishore sir. He always, the logical thinking behind the anatomy. Everything was precisely calculated. The way he used to teach, Mr. Sham
Slow chala
Krishna
na.
sir. It was amazing and unmatched with any of the faculty I have seen in my medical career. So thanks for all those gurujis who motivated and gave us such a wonderful knowledge. Thank you. Over to you.
So Amruta,
Yes. Is it Arun?
what? Yes, yes.
Yes. Hello,
Can you
Arun.
see me?
We can
Hi.
see you, and we missed you
I
at the
cannot see you.
reunion. You cannot, because I had to change my instrument last minute, and the new instrument doesn't have the webcam facility.
So what is the theme of this meeting, or what are we talking about?
So we are here together today for celebrating, on the occasion of celebration of 100 years of GS Medical College and KEM Hospital. So this has been organized by Dr. Natarajan and his team. And we were asked to choose a particular date on which we could meet virtually. So our batch. So that's how we are all here to remember all our experiences from GS.
Excellent. So is Natarajan sir here?
Yes, he is here.
Okay, excellent. Excellent. So please continue. Sorry for interrupting.
How are you, Arun? We missed meeting you at the reunion.
Yeah, I could not come because of I was too much engaged in, I had recently moved to my own city, so yeah, that's why.
Okay.
So in your next reunion, no, I will definitely join.
Sure. Arun, I would like to, I have a list of questions with me. I'm asking that we are going by that list, and it is covering the major points. So I'll ask you one of those. So what were, is there, what memories you have of your fellow students, seniors and juniors, and their friendliness and helpfulness?
Memories of fellow
your,
senior
yes,
and junior.
Yes, of your,
And?
were they friendly, helpful? Did they rag? Like, what memories you had with your
Of course.
batchmates, with the seniors, with the juniors, with the hostelites, with
So
your group of
I need not be
PMPIs?
I need not be formal, no, I can be very
No.
frank.
Yes, you can.
So, I had a excellent experience because, as you know, we had a different path. We came through the All India quota route. So we had quite a different kind of a hostel life. And some of the hostelites here would definitely agree, because we were the batch who was ragged, like, not, I would not say very much, but to a great extent. So we have given good amount of ragging. We had a connection with our seniors after ragging. I think after ragging, they kind of develop a different kind of connection with us, because after ragging, I don't know, they kind of become more friendly.
Yes.
And more, I don't know. So, of course, we had a very good interaction with our senior batches, and many of our senior batches who were supposedly notorious or who जिससे थोड़ा लोग डरते थे, they were all from UP and Bihar. So, after ragging and after interacting with them, we all became friends, and we used to start sitting together at Katta and
So,
discuss even when we had difficult times in our life. We used to have good discussions, and it really affected our psyche, I should say, because in a good way. Because when at difficult times, you never know who becomes your good friend or a
yes.
good guide, and things starts unfolding thereafter. So of course, any interaction with once you break all the barriers, so there is always a dark side of ragging, of course, but always there are, of course, two sides of any coin, as
Yes.
we know. So of course, we have seen all those things in our college
And
lives, and when we look back, I find it quite funny, interesting, and yeah, it's kind of an experience. So yeah, that's it.
what was and you mentioned the Katta was your favorite hangout? The college Katta was
Katta
your
and plus the library reading room, and of course Priyanka is here, so she would also agree, and many of us from the PMTites so-called group, we used to hang around in the reading room and in the Katta, and uh, yeah, and sometimes in the basketball court.
yes. Any were
Of course,
there
Priyanka used to play basketball.
yes.
Yeah.
Yes, so now I'll go ahead to has somebody joined in just now? Oh, Kiran. Hello, Kiran, are you here? Okay, I'll just ask the next question. Any of you can.
Hi, Amruta. Hi.
Hi,
Sorry,
Kiran.
I was just
How
calling
are you?
someone.
You've
Yes.
not spoken.
Yeah, I'm fine. I'm fine. I'm just listening.
Fine. Good,
Good
nice.
old memories.
Yes. So, what
Right.
are your memories?
Actually, ragging was just a bahana to get to know each other. Our seniors did rag. It was not too much, but we used to live in Naigaon. Uh, not Naigaon, Parel, as a in a one room. Yeah, first year, and the senior used to call us in the Naigaon hostel on Sundays. Two, three seniors were very, very notorious. And initially we were too much afraid, but later on, instead of ragging, it becomes a normal communication, and they used to give some tips and help us in many. And they friendship still remained with those seniors. Some of them are
Yes.
from Nasik, and we still are in touch. So the maybe in the older times, ragging may be very bad, or in some places, but at least in KM, the experience of ragging, the word ragging is probably wrong. It's just getting to know each other in some
Yes.
unusual way. So
Oh, yes,
yeah.
yes. So, and did you witness any problems in studies, like in fellow students, because of lack of familiarity and expertise in English?
Yes, yes. Initially, I'm from Nasik, and I studied in Marathi medium. So English was very challenging, particularly in an ANAT department where it was almost an international standard, as many people said. Even now, we realize it's way ahead of its time. The grading system, or the letting students choose their own partners, the everything is well organized. But the English part was very strict. Maybe that is for the reason, I think, because the entire medical education is in English. So initially, many people from the interior parts of Maharashtra, like me, got some problems with the English communication. But yes, later on we picked up meeting with seniors, realized that's not a big issue. I mean, it's not like everybody is speaking, will be speaking, everybody will be speaking in English everywhere. It's only for the academic part and vivas, etc. Biochemistry department was quite helpful for those who are hostelites. I mean, they during my first biochemical viva, I was not there was not a single question related to biochemistry. They all asked like, "How are you? Where are you from? Are you settling? Is there any issue?" So in that way, it was very good experience actually.
Nice. And hostel life was fun.
Yes, yes. Hostel life, yeah, it was quite fun. I mean,
Anything you would like to suggest for improvements there?
no, I don't think. In fact, making it too formal or too controlled will just take away the fun of the hostel life. I mean, uh, today, like there are 2, 3 medical colleges in Nasik, and things were are quite formal there. Like someone mentioned about the mentor-mentee program, where even the PG doctors are assigned to the UG student as their mentors, and they are supposed to help them in everything. Like the student gets fight with somebody else, and he or she can come and complain to the PG student. I think these things can be handled at their own level. Yes, mentors are helpful in certain ways, but some things are important to grow up.
Informal is more important, I think.
Yes, yes.
Yes. And what about the girls' hostel? Both the Priyankas I want to ask. How was
Girls
the hostel life?
hostel, yeah, the like things are unmatched in hostel life. You never get to live it again. So those were maybe the wonderful days of life.
You
What we
thoroughly
stayed in
enjoyed the
hostel.
late night chats in the girls' hostels.
Definitely, definitely. So girls hostel was like quite happening place where we had all the fun throughout the stay in Mumbai.
Any canteen memories you have, Priyanka?
Yes, definitely. Like canteen was just a reason to get a break from studies. Library se utho, canteen mein cutting chai piyo, have a relaxing break for 10 to 15 minutes, then come back again. So, and even the canteen uncle is still the same. Last time when we went, we met him. He's such a nice person. He's still serving the same bread, butter, and chai, same food. So I felt like nothing has changed.
Yes, canteen was very. I remember canteen the first year. So when we used to go for anatomy dissections, so I remember our seniors have told us that have a good breakfast and go. So by the time we climbed 2 fleet of stairs and come down to, we felt hungry, and so we just. So another thing was that in the first year we were advised not to go to canteen because of the same thing that it is possible that we might get dragged. So what we used to do is we have to quickly take one vada pav from outside and run with that vada pav, and we used to sit hide behind the dissection over there. Same way when we had clinical postings, just to energize ourselves before going for the wards, we used to catch hold of one vada pav and go there. And then apart from that, we had like lots and lots of memories sitting, chatting in the canteen for hours together. So it was an amazing place, the central point where everybody can meet.
Any other favorite hangout there which you like to go to?
In the college or
In the college or outside, wherever the hangouts, the ones you all would enjoy at.
I
No,
think
even the
everybody
PG canteen was also very nice. The food served there was like quite delicious.
PG canteen.
Yeah, that
Yes.
was nice.
And what about the cafe outside?
Inside
There
of Kalpadrum.
I think Milan was the hotspot where everybody used to go for
Milan, yes.
for food.
Banwaska.
And then Aditi, a little, if you want to have some time and
Aditi.
Sundays.
Yes, Aditi was celebration.
Yeah,
Yes.
outer section of the library also.
And
Yes.
that juice wala was for like when we are having nights that time to have a nice drink, healthy drink.
Yes.
Nearby Madira and Sarovar was also good.
Those places we did not know. Those have no idea, I think. So another question I will go to now. What do you remember about the lectures, the changes in syllabus, the exam patterns, and any exam hall experiences? Anybody can answer. Just go on answering and add your experiences.
I think that open book test from medicine was very
It was
nice.
amazing. Hassel?
Still, it was difficult to find some
Yeah,
answers.
it was still difficult to find the answers and right. And what about the lectures? Any memory of the lectures?
I think I remember
Looking at
Natarajan sir
garbage.
explaining about each and every parts and why it is called that, the origin of the words.
Yes,
Like
yes,
the
yes.
radius is because it's a arrange, I think radial kind of a thing.
Yes.
So for that it's called, and so
But
that was memorable.
since it's explaining the word, so when I was very young, I wanted to become a teacher. So teacher was my favorite person always. So when I went, I think the first day sir taught that doctor means he dissected.
Teacher, I remember that.
Yes.
Yes, and I also now kind of tried to do that when we do lectures for UG. I try to break down a word like lichen planus means moss. So what is the meaning of that? I still remember sir going that method, and somehow we try to carry it on to the next generation in whichever small way.
So I was happy that I could become a teacher after being a doctor also. Another thing I remember in the forensic, the HOD, when the HOD used to come and take lecture, he used to shuffle the entire class. So our class used to sit like girls one side and boys one side. When used to start making everybody stand up, sit there, sit there. So everybody was scared. So we tried changing that pattern. We tried mixing. Still, he used to shuffle the whole class when you come for the class.
I remember one lecture experience. There was one particular sir we were terribly afraid of in forensic medicine. We were so afraid of him.
Savardekar, sir.
I don't know which one, but he had asked the question that what is the meaning of the word consent. And I was in my own mindset, and I was not even paying attention, trying to hide, not come in his eyesight. And when he told me, the fellow student told me that it's your turn. I got up and I said, "Sir, consent bolega to." And then I didn't realize I said bolega to, and the entire class started laughing. But that is my experience, that I was not attentive enough, but I just started off in my own language. That is my memory, but I was so scared in that lecture always. Forensic medicine was scary.
I think Arun can share one experience. He also had a very nice experience.
Yes, Arun, please. Hi, Swati.
Hi.
How are you?
अरे मस्त एकदम enjoying the Pune weather.
Very nice. Swati, we are talking about lecture experience. Can you share
Yeah,
any lecture experience from our college?
I remember one forensic lecture when some, guy was forced to sit in the girls' row. I don't remember the guy. But there was some lecture, I think by forensic HOD only, and we were sitting absolutely clear line like males and females completely divided. And he was accusing our class that we never ever were seen like, intermingle male female sitting arrangement. You remember who was that boy? I don't remember that.
Arun, do you want to share
As a as a punishment to that boy, he was forced to sit in the girls' side of our class.
Yeah, we don't remember, Swati. But there was one experience Arun would like to share. I think Priyanka wanted Arun to share. Arun, can you unmute yourself? Join. Okay, so we can't hear Arun. Chandresh, come. I am actually sitting in Just Look, and Chandresh is helping me with his laptop, but he's not willing to come and join the meeting. I'm asking him to join, but he's not coming with me. He has his own work.
Come here. Where are you?
वो पूर्वा आएगी तब चंद्रेश आएगा. पूर्वा को घर से ज्वाइन करने को बोलो.
पूर्वा को किसी ने कॉल करके बोलना चाहिए, तो आ जाएगी वो, और ये भी आ जाएगा. Anybody else want to share lecture memory, Bhika?
So one more.
Yes,
I think Dr. Nitin was there. If anyone remembers.
Anatomy,
Anatomy. And he used to start like in the Rajdhani Express. And if you ask him, sir, I couldn't understand. He used to get so frustrated. So I remember that. I mean, that was a memorable experience.
I remember Salmonella lecture very clearly. I mean, the way I was taught, the way sir taught how to read any topic for microbiology, pathology, and he started the lecture with directly from the symptoms, which gave me clear idea how to read any topic. First jump to Patankar sir, no, Patankar sir, microbiology lecture, Salmonella.
Okay. And Swati, which teacher impressed you the most from our college and who left an indelible mark on you? Best.
Of course, KSK and and Karnad sir.
I'll ask everyone actually. Bhika, what about you?
Yes, Karnad sir, he such a knowledgeable person. He shared his knowledge with all of us, and also KSK sir, Dr. Natarajan sir, Pruthabian madam, Mruti sir. He was another talented professor in physiology. His lectures will always remain in my mind. In final year, there was one senior resident in medicine, Mr. Dani sir. No, he was he used to
Ajay Dani,
He was
Saurabh Dani.
Saurabh Dani.
Yes.
Yeah,
Saurabh
yeah,
Dani.
Yeah,
Yes.
Saurabh Dani.
Yeah,
even Amol Akhade was quite good.
Yes.
The Coop clinics of Amol Akhade.
yeah, he used to take, some of our friends used to arrange secret clinics in wards, and this. So these are all the memories I cherish now.
Anybody else like to add to
I
that?
would like to add,
Yes,
KSK sir, I will still never forget till very long time his worm in the thing. Human being is actually a modified worm when he
Yes.
showed that
Yes.
posture in the class.
Yes.
Even the gate part means like the gate he
Yes.
explained
Yes,
So he demonstrated in a slow motion,
demonstrated.
paused, and every muscle, every.
we still remember very much.
Yes.
Even the farmer lecture, I remember the clerk was very sincere and used to mark all those who came even 1 minute late. He used to never give them attendance. So whenever farmer lecture used to be there, we used to be very alert and we used to be very punctual. We start I used to travel from Kalyan, so we used to get one train early for all the farmer lectures to reach on time.
Even for that biochemistry, I remember that the ma'am used to come from the back. She used to start speaking from the back. So I used to see who is teaching us. And then suddenly she would appear. She would run here and then and she would teach.
The biochemistry teachers were so nice that Patta Faka ma'am was there. I used to put my journal every single time in that biochemistry lab. But she used to keep it in cupboard and used to return to me at next practical every single time in whole throughout my first year. So I that was a really nice experience. They were really helpful to us.
I would like to share my experience in my final year OBGY journal case writing. We were supposed to write 20 cases in OBGI clinical cases. We were supposed to take history and it was, but I took a journal of my senior and everything was copied, including the name of the patient.
The name was actress's name, right? All the actresses of that time. And even Parulekar sir had taken special objection on that. How come actress's name? And
there was one senior resident, Surekha madam. She was from Indore, and she pointed, everything that the date is dates are also in some cases I copied date also backdated. So she looked into the journal and she noticed that this guy has copied the whole journal. She called me and the exam was just final exam is 2 days was remaining final practical examination. She asked me to write complete whole journal 20 cases OBGY. I started crying because 2 days left for our final practical exam and she's asking to write me completely. She was right because I have made a mistake in that case, but it reminded me that experience remained in my mind.
Nice. Any Gymkhana memories anybody wants to add? What departments, anybody? I don't remember actually who were active in the departments, the secretaries. Anybody does remember any Gymkhana memories?
Right. So that was a good experience organizing events in athletics.
Nice. So you were the secretary, Priyanka?
Yes, athletics and athletics.
Okay. Okay. And what about cultural festivals? Avishkar.
I used to
Inform us.
participate in every festival. So now we are discussing now the cultural part or the extracurricular part of GS. And that was another amazing experience. So I used to play basketball, and I continued my passion of sports, which I developed during school time. I could continue it over there. And I used to participate in most of the sports: badminton, basketball, sprints, everything, and as well in the cultural program as well, all dance programs, even Apurvai. I have participated.
Yes, yes. I remember we had fashion show. We had organized fashion show also.
And then we had even the hostel as well. So
We had even gone to AIMS and participated
Pulse,
there.
Ames dance, we remember.
Pulse, actually, Priyanka taught me basketball for the first time in my life.
Wow.
And that I now carry on to my son. I keep telling him, oh, I played that time when I was in college for once.
Was there intercollegiate activities that you all went in?
Yes. So I think basketball as inter-college also we have participated, and definitely during the AIMS Pulse, I mean the fest which we all attended, we participated in dance and many other activities which were held there.
I still remember one basketball match. It was conducted at our premises between IIT Bombay and our college. Our team, GS team. I think that I don't remember the name of the seniors, but that was excellent match. And IIT Bombay team defeated our team. That Chaitanya, sorry, CG was there in our team. And we unfortunately we lost that match, but I enjoyed that basketball match.
I think I was the only one who played lawn tennis there, so I had to catch hold of people to play with me. Instead of catching a place in the library, I used to first go and play some time in the morning on the lawn tennis ground. Kiran, would you like to add to any cultural festivals, any memories?
No, I was always in audiences.
And
I didn't participate in any of those, and that is probably one of the regrets. I think KM, badminton I played some, but not too much. I think KM offered a lot of extracurricular activity opportunities. Basketball, badminton court was very good actually. When we joined, it was not, I think, needed a renovation, but afterwards there was like wooden flooring and all. Indoor court was there, so yes, I mean.
Yes. In our batch, were there any innovations done which anybody of us can remember from our batch? Was there anything done? No, I
What kind of innovations?
I think there's a question here asking any innovations done by our batch which you remember. So they have not mentioned any kind. Anyway, and the last question is reunion memories. So I think most of us were there at the reunion.
Yeah.
Yes. So what were your memories? What are your memories? It is just 1 year ago. It seems like yesterday to me, actually. I really enjoyed organizing it. So any of you who want to add to reunion memories?
No.
That's Swati's kid, I think.
Yes. No. Hey.
Okay, then, sir, we are done with the questions.
Yeah. Hello. Has everybody spoken?
Yes.
All those on the list? No one has been left out? Just check
Sir,
once.
sir, Sandeep hasn't spoken, I think.
No.
Everybody's.
Everybody's.
What about no?
Hello? Yes. You spoke,
Hello?
ना, Sandeep? Yeah, hello.
अरे मैंने तो बात कर. I spoke.
I
spoke.
thought वो नीचे गया icon,
Yeah.
तो मुझे ध्यान में नहीं आया.
Umesh has not spoken. I think he has joined.
Where is he?
Umesh is yours.
Please speak, Umesh.
Umesh.
Give him a question so that he can speak something.
Yes. Hello, Umesh. Shall I ask you something? Hello, Umesh. You should unmute yourself. Hello. Can you hear Umesh? We cannot hear you. Chandresh is right behind me. I want to ask him a question.
I'm not.
They can still hear you. You can speak. He's not
Okay.
ready to speak. Yeah, take it. Speak now. He's not ready to speak. Sir, Umesh, we cannot hear, and rest of us all have spoken. Arun has not shared his experience of that forensic
Yeah.
medicine.
So shall I
Yes,
share my
please. Yeah, we
experience
have
now?
still 10-15 minutes to go.
So it was a revision lecture taken by Savardekar sir, and me, Navjeet, and Vivek Yadav, and Aditya Mantri, we were playing a tennis game on Sony Ericsson phone. So that was golf. So we were playing golf, and we were talking to each other, and it was a very serious lecture by Savardekar sir. So he pointed out that I was talking to Mantri. So he told me to get up, and he asked some question, and of course I did not know that time. So no. Then what happened is he saw us and he told stand up. So what we did is we just hid beneath the desks and we tried to run one by one. So Vivek Yadav went out because we were not ready for that revision lecture. So we just wanted to go out. So he ran first. Then after that, Aditya Mantri ran. Then Navjeet ran, and I was the last one to, run. But I was wearing a yellow shirt that day, and Sir saw me, and all the three of them, they had ran away and they were playing golf in the katta, I think. So he caught hold of me. Then he said, "You come back." So the whole lecture was there. Everyone was seeing me, and I was not ready for his questions. Already Vikram Dekwal and some other people were standing for punishment kind of thing because they had not answered his consent and other kind of questions. So he called me down and he asked me that Arun, you were trying to run. So I said, no sir, I was not feeling well, so I was having vomiting, so I just wanted to vomit. So he said, then let us go out, and you must have vomited. Then there must be vomit on the step, so just we can go out and check. So I said, no sir. So that was the thing. Of course, Vibhash is also here, so he must also be remembering that because he was also sitting there. And Rahul Javle was there with me. He had also run before me. So there were 4-5 people who had gone out of the lecture hall. So that was one experience.
Hi, Vibhash. Nice experience, Arun. Are you there, Vibhash?
Hello.
Hello, how
Yes.
are you?
Hey, I'm good.
I think it's
Hi,
morning.
how's everyone? Yeah, it's morning time here, so I'm
Good
just
morning.
like
Yes.
setting things up.
So we have almost around some 10 minutes to speak. So would you like to talk of any experiences from college? Something that
Oh,
you is very memorable.
I mean, lots of things. I think where should I start? I think I remember like our like soccer matches quite a bit. I used to play a lot of soccer and then our trips and definitely like great lectures by all the teachers, which we used to bunk a lot. But and the worst memory I had was like I was not like allowed to sit in the finals, like university like exams, like during the third year because my attendance was too short for the I think like which ophthalmology lecture.
Can you hear me, Vibhash?
Yes, yeah.
Can you share the experience of me, you, and Deepak Agarwal regarding the section?
Oh my god. Oh my god, that was hilarious. So yeah, so during the first year like we all were like grouped in like group of three. Like we used to do dissection together, and I think for some reason me and Arun. So me, Arun, and Deepak Agarwal, we were together on the table, and for some reason, I think we were not initially very interested in dissection. So we used to go to like other table to learn things, and next day, Deepak will always ask us, we should do the dissection and learn about things, and we are like, okay, that's fine. I mean, you can do it. And so next day, when he used to see the dissection, like cadaver, next day for the dissection, things were already done. So so it was already dissected. So he was like, we didn't do anything. So we just like told him, like we lied to him that we usually come in the evening and night and do the dissection and learn things so that we can focus on things. So he was really upset, and he told our seniors regarding that they are not letting me participate in the dissection. It was a big mess, and then our seniors called us, and obviously it was a joke, but that was like really funny. I mean, we still laugh at that. What other things? I think.
Dissections were not being done by us. It was
Yeah, it was not us. Yeah, definitely. I think it was
I
like
tell
one
you.
of the race.
So the girls team was there on the other side, and we used to fight amongst ourselves that makaru makaru. So then we thought the other side is empty, nobody's doing that further.
Oh, is it? I mean, we used to think like it was
Table
like
also there was some other group of girls, but on my table, we used to do dissection on both the sides.
oh, really? Was it like registrars? I think they were doing it for their, the research project or something. Like they were doing like later. And yeah, a lot of good memories, I
What about
think.
the teachers? Which teacher impressed you the most?
I mean, there's like, so I mean, first year, Sham Kishore sir, Natarajan sir, uh, who else? I think who was the head of department for physiology? Like, I am trying to remember that time.
Dr. Murthy, I think.
Oh, Dr. Murthy. Yeah, we used to like do a lot of mimicry. Like, is the way he used to teach us. Like, the benting and the best. Like, I still remember the insulin part. The like who discovered the insulin, like the benting, and I mean, and then biochemistry was fun. I think all the teachers, they were great. And then I still remember like the anatomy classes of Kushale sir, where he used to like relate organs with certain things, like hawa mein kya udta hai. So everyone was like, sir patang nahi, kya udta hai, sir bird nahi. So sir plane. So knee is a like plane joint. So he'll be like, it's a plane joint, and then he used to relate things. So that was like really funny. And same thing with stomach, muscular bag, to like so that students remember those things.
Yeah. So,
And
yes.
and who else? Like, and then second year, I think, I don't know, like second year, I don't have a lot of memories. I think like we were just like bunk.
Yes. Do you remember any displays or boards or plaques on campus which have stayed with you in your memory? Like anything that visually, like this part of the college campus or some board, something written somewhere? Maybe near the library, the message downstairs.
The library message.
Yes. It
Library,
was
yeah.
Sailing a boat without
it was
some
something
Yeah,
Osler.
no.
William
I was
Osler's
I was not a
William
I was
Osler
not a
was
like
there.
Yeah.
Like clinical examination or versus reading the books. It's comparing that like.
There was one
Yeah, no.
It is
anatomy
worth
hall.
to have done something and lost then never to have done at all. Something on that line.
There was one in anatomy dissection hall. I think the mind things it's like eyes don't see those things which your mind doesn't know. That I think everybody was.
That was this. Yes.
Yeah.
Anybody who has not spoken and would you like to add something? Okay, sir, we are done here, I think.
Yeah, fine. Now the student can take over. Arushi,
Yes, sir.
yeah,
I
please take
request
over.
the tech team. I request the tech team to please the reflection video.
Very good evening to you all. It is indeed my pleasure to speak about Reflections on Medical Humanities, annual volume published by Dr. Manu.V.L.Kothari Chair and Division of Medical Humanities, Gosumec Alumni Association, under the patronage of Dr. Sangeeta Rawat, Dean, St. GS Medical College and KEM Hospital, Mumbai. The first issue of Reflections was published in the year 2019, the theme being History of Medicine, Looking Back to Improve the Future. The book comprises invited essays, poems, cartoons, quiz, crossword, and articles which were published before in different medical journals on evolution of branches and development of specialties in healthcare, great personalities and inventions in medicine and healthcare overall. The issue for the year 2020 was based on interpersonal relationships in healthcare. Again, invited essays and cartoons on doctor-patient relationship, doctor-doctor relationship, and medical teacher-student relationship were included. For the year 2021, we chose very apt theme of COVID-19, the human angle. Essays and poems in English, Hindi, Marathi, paintings and photographs contributed by teaching and non-teaching staff and students of St. GS Medical College and KEM Hospital who shared their experiences both on personal and professional fronts during the pandemic. The theme for the year 2022 was literature and medicine. It is a collection of articles, book reviews, and poems in English, Hindi, and Marathi, and also paintings and cartoons related to the theme. Now, for the years 2023 and 24, the proposed theme is Reminiscences, Our Days at St. GS Medical College and KEM Hospital. As we move towards the centenary year of our institution, let our fond memories come alive in the form of nostalgic writings about our learnings, not only medicine, but also life lessons that we learned here. Let us talk about our devoted teachers who inculcated values and shaped our lives, priceless friendships which we cherish lifelong. Our writings will instill a feeling of pride and a sense of belonging in all of us, the readers of the book. We, as well as the future generations of students, will understand the power and beauty of expression and reflections. We will be enlightened about the history and glory of our institutions, past students who have contributed to the welfare of the society, and the role model teachers and mentors. We know, irrespective of the generation, we are bound by a common bond of being GSites. However, we also need to accept and adapt to changes which are inevitable following technological advances and societal transformations. At the same time, the students will learn that even though the changes are occurring, the humanitarian values and principles of ethics are unchanging. Hence, we appeal that the reminiscence and nostalgic memories shared on this platform of virtual reunions be expressed in the form of writings to be included in our next issue of Reflections. I, Dr. Swarupa Bhagwat, Editor Reflections and Associate Professor, Department of Transfusion Medicine at this institution, will be privileged to connect with the individual batch coordinators for sharing more details regarding the same. Thank you very much.
We'd like to thank our Dean, Dr. Sangeeta Rawat ma'am, and academic team, Dr. Pathak sir, for their continuous support and encouragement. We thank the Gosumec Alumni Association for administrative support for correspondence and financial transactions from Dr.M.V.L.Kothari, Chair and Division of Medical Humanities. We thank Mr. Tushar and Mr. Badal for audiovisual and technical support, Mr. Maitre for video recording. Last but not the least, a big thank you to the batch for their enthusiastic participation. Thank you.
You, Arushi.
Thank you.
Thank you everybody for participating.